Steve, one thing that I am often asked is, should I still take some sort of medication even after I have a hair transplant? Can you talk a little bit about the treatments that you've taken and currently take and why that's important?
Absolutely. So let me start off by saying this, Lance, that when I talk to patients, it's really a two-prong approach. One being preventative treatments, and let's try to keep the hair you have. And then the second, of course, being the hair restoration procedure. Obviously the first, which is hold on to the hair you have, is more important. The problem with that is, in the industry, nobody makes money on that. Maybe the pharmaceutical companies, maybe the device companies that make laser caps. But I don't want to sound like Mr. Perfect, but nobody makes money unless they sell you a hair transplant, at least in the hair restoration industry. So to me, it's a little bit of a conflict of interest. I just believe in being patient, getting yourself educated, and figuring this out before you make your move. When it comes to preventative treatments, of course, there's 3 treatments that are FDA approved. There is the finasteride or the Propecia, the 1 milligram for preservation hair. There is the minoxidil that's been around a long time, and then there's these laser caps that have come a long way. Laser low-level light therapy has come a long way as well, and women are real big fans of it because they can't use the Propecia. So there's a saying in the industry that I've heard a lot of doctors talk about, and they say that it's easier to keep what you have than replace what you've lost. The problem with that is it slows down the process, especially for the emotional people, the young guys, the women who are just beside themselves that want to fix this right away. No one wants to take their time, at least in this world, in this day and age. Everybody wants immediate satisfaction.
Yeah, that sort of instant gratification that we're so used to, especially on the internet.
Completely. So we always want to gravitate toward what looks the best. And the reality is that, again, the two-pronged approach. So what are you going to do to keep the hair you have? And then what are you going to do to restore the hair you've lost? And where are you going to go? And who are you going to choose? And how are you going to do it? So there's different ways that we can attack or we can battle hair loss, which is, by the way, a progressive battle. It's going to keep going. My crystal ball that we talked about when we started this conversation would tell you that if I had a gun to my head, and you're right now 30 years old, by the time you're 50, you're going to have less hair. I can pretty much put money down that says, even with all the treatments, that's going to happen. But what we want to do is slow that progression.
Gotcha.
The second part of this preventative treatment kind of discussion is, it's all about, I think, what we're sitting here talking about when we're talking about specialists and hair restoration doctors and hair transplants, different types of hair transplants, is, what's best for me? What should I do? How much should I spend? Which way should I go? What kind of scar am I going to get? We're all looking for that perfect result. And all these different variables, one of the most important variables are the preventative treatments. There's a lot of buzz out there on the internet about the downsides of Propecia and all the side effects, and that's for a whole nother chat. In reality, I've been on it for 16 years. I use minoxidil once a night for 20 years. And I just recently, 8 months or 8 weeks ago, got the Capillus 272 laser cap. And I think that that's been thickening my hair as well. I mean, I'm hanging in there, man. And I just want to buy myself 5 more years, 5 more years, 5 more years. The way to do that is to stick to your preventative treatments, because some doctors will call it the hair transplant treadmill, where you do a hair transplant, you look good for a couple of years, you lose more hair, you're frustrated, you go back and yell at your surgeon. He tells you that you weren't on the preventative treatments, you do another hair transplant. You're happy, it grows in, you come back 2 years, 3 years later. What happened? You didn't get on the preventative treatments, you need another hair transplant. Not a good thing. I always say it's good for business, it's very bad for the patient.